Yeah, the guy on the other end. The guy on the other end is how much lower? I feel like 2 years older. I feel like, why is that guy?
It's exciting, isn't it?
Live TV. Oh, no.
Hi, I'm Jen. I picked around and I like I heard it go.
A little bit. It can be a little shaky.
It's like a workout.
You were what? I was about to say something and then I ate a large bite that I didn't realize would be as large, so it took me out of the process.
Frustrating game. Right. We got a couple more folks coming down. Good afternoon, everybody. Is this thing working? We okay? You guys. I don't think we're. I think it's just picking up.
The mic on.
Oh. There we go. My Stratocaster. All right. Well, thanks everybody for being here. Good afternoon. Welcome to Bluff Plantation in Augusta. This is a unique collaboration between the Medical College of Georgia, GRU, and RiverMend Health. I'm Dr. Bill Jacobs. I'm the Chief of Addiction Medicine at MCG GRU and the Medical Director for the Bluff Plantation. Thanks again for everybody coming out to celebrate this. This is a historic event. I'm so proud and so excited to be back in Georgia. This is home for me. As many of you know, I'm a Georgia native, born and raised in Gainesville, Georgia, and a graduate of the University of Georgia, and proud graduate, got the ring of the Medical College of Georgia, class of '81, and with the help and support of many friends and colleagues, especially Dr. Peter Buckley and my chairman, Dr. Vaughn McCall, we're really changing the paradigm for the treatment of patients who suffer from the disease of addiction. You know, addiction has more stigma associated with it than any other disease. Even with parity, patients and families are often too embarrassed to ask for help. And when they decide they need help, they don't know where to turn. Most university academic medical centers don't have experts trained in addiction medicine or treatment programs. We have both. This treatment facility, for many folks, you know, treatment's been a revolving door of detox and episodic short treatment, really responding only to crises and relapses. We know that airline pilots and physicians and attorney addicts recover. You know, studies have shown they recover, return to their families, and have full productive lives. They know detox is just the first step, but it's not treatment itself. We know that treatment works when it's delivered continuously, not episodically, in the right dose. I've worked for over 15 years with professionals where we've seen it happen, and we've reported our successes in peer-reviewed journals. Now we're taking that proven, successful treatment approach to all patients, not just doctors, nurses, airline pilots. We learned a lot about treatment from Mrs. Betty Ford. She moved treatment to a remote location at the time in Palm Desert. She insisted on a healthy diet, exercise, meditation, and yeah, she recruited some of the top physician experts as full-time evaluators and healers. It takes a team, though, a setting away from crisis and craving, time and energy to recover. But it also takes experienced professionals, including therapists, nurses, recovery coaches, exercise physiologists, dietitians, and chefs. Fortunately, we have at our disposal the full resources of the academic experts in technology at MCG. We have access to the best neurologists, internists, infectious disease experts, cardiologists, gastroenterologists, of course psychiatrists and other experts. Often we need those experts to clear up the consequences of past use, abuse, and addiction. Just a couple of weeks ago, one of our first patients arrived. I met him in our level 1 trauma emergency department. The patient came after a successful detox, but had tremendous craving and anxiety. He had chest pain, and he admitted to us on arrival that he'd previously been told he had a heart attack, but no follow-up. In just a few hours, with the help of our experts at MCG, we were able to evaluate and stabilize him and get him into treatment out here where he's doing well. On the 3rd floor of the MCG's primary teaching hospital, we have an inpatient unit where complicated patients can be safely and humanely evaluated, detoxed, and stabilized, and where all their co-occurring medical and psychiatric conditions can be evaluated and treated by experts from all medical specialties. This is unique and much needed. We have already admitted and treated patients with alcohol problems and severe depression, drug problems and real chronic pain problems, drug use that people have been doing to help deal with their past early life traumas. Then they're ready to come out to this magnificent setting. The Bluff Plantation facility has a healing atmosphere. The environment is right to start over, to remember and build on the past, and to move forward toward recovery. Residential treatment works because the addict is safely removed from cues and cravings, and where the psychology, counseling, therapy, 12-step, trauma, mindfulness, meditation, exercise, and other modalities can be given by our team of experts here. We've handpicked this team. Who wouldn't want to work here? Hey, look around. To provide them, these patients with the most intensive dose of treatment necessary, many hours each day, and to allow them to make safe and successful transitions back to their families and loved ones. But we don't stop there. We'll continue to follow and support our patients with family work, meetings, recovery coaches, telemedicine, random urine drug testing for 2 to 5 years after their stays here. We know that works for doctors, nurses, pilots, and we do it because it works and because we want our patients to remain in lifelong recovery and avoid chronic relapses. So, as you can tell, I'm just very proud to be home. Proud to be a part of this MCG mission. Thanks you all for coming. Thank you. And now I'd like to introduce Dr. Peter Buckley. He's been a great supporter of this whole project. Dr. Buckley was the 26th Dean of the Medical College of Georgia at GRU. I asked for his executive assistant to send me a short bio, and it's massive. I thank goodness they didn't send me his CV. But Dr. Buckley is a former chair of psychiatry here. He's a psychiatrist. He's a world expert in schizophrenia. He's a professor of psychiatry, pharmacology, and radiology. He served as interim executor, currently interim executive vice president for health affairs for GRU, and interim chief executive officer for Georgia Regents Medical Center and Medical Associates. He's extensively published. He's editor of journals. I can't thank him enough for being here and for his support. Thanks, Dr. Buckley.
Good afternoon, everybody.
Good afternoon.
I would like you all to just turn and look to the right. Isn't that spectacular?
Yes.
So what a great place to be. What a great day to be here. And congratulations, Bill, both on your leadership here and then also on your remarks. Often when you get to come to an event like this, you say what a long time this has been coming, but in fact this has been incredibly quick due to the leadership of RiverMend and also due to the leadership of our department with Dr. Vaughan McCall and with Dr. Joe Ritchie. And so I thank all of you. Augusta as a community has been a long time waiting, but the incubation period from the initial discussions to today was remarkably short. And so we're really delighted to be a part of this. You already touched on the need and the personal need of addiction disorders. And I will remind you that the global burden disease, re-updated just this year, indicated that the burden from mental illness and the burden from addiction disorders remain in the top 10 most disabling conditions known to mankind. And so the need is very great, and the need is great in our community. And this venue and this service will serve this need in a state-of-the-art manner. And in many ways, history defines our future. And this lodge has an amazing history that's relevant to this program. And so, from my understanding, this began as a corporate retreat house where leaders could put their motivation and their resilience to skill towards the betterment of their work. I'm also told that this facility was a place that some of our golfers would come when they visited Augusta for the Masters. And so they too took inspiration for their own leadership and their own resilience. And so it seems to me remarkably fitting that placing here a state-of-the-art addiction model that focuses on the resilience of the individual is an extraordinarily coalescence of history and of its future. And you will do great things here, because in this environment, this is the natural environment for healing and recovery, which is at the cornerstone of any modern treatment of addiction. And we are very grateful to be part of this partnership. We thank you, Bill, we thank you, Julia, and we thank the staff that have come on board so enthusiastically early on. This will be a great gift to Georgia and a great gift to our community. And we are not only interested in the outcomes and the care that will be rendered so well here, we are also a training facility. And so Bill and Vaughn, in their efforts, have ensured that our residents and our colleagues will have the opportunity to train in the state-of-the-art addiction programs so that they will be able to deliver the best care for people in recovery as they go on in their careers. And so this to me seems a very fitting venue. It is a terrific model, and with that, nothing can happen other than great success to all who come here. So thank you and congratulations. I'm delighted to be part of this.
Thanks, Dr. Buckley, and thank you again for your support. It's my pleasure now to introduce my chairman, Dr. Vaughn McCall. He's a Case Distinguished Professor and Chairman of the Department of Psychiatry and Behavioral Health at GRU. He's board certified in general psychiatry, geriatric psychiatry, and sleep medicine. Has already helped treat one of our patients out here. Research interests include depression, electroconvulsive therapy, quality of life, insomnia, and suicide. His research has been continuously supported by National Institute of Mental Health since 1995. He's also extensively published more than 400 publications, including 170 peer-reviewed articles. Thanks, Dr. McCall, for being out here. Appreciate it.
Thank you, Bill. Seeing is believing, isn't it? And I was talking to some other colleagues earlier trying to describe what the Bluffs was like. It really is impossible to do it justice unless you've seen it with your own eyes, and it, I think, elevates this project to a whole new level. Great ideas like the Bluff Plantation require great partners. And I agree completely with Dr. Buckley that the time from conception of the partnership to the execution of this day has been on a remarkably short timeline. And it's only been possible because the interested parties had a common vision and a remarkable amount of trust right out of the gate. There was, in my opinion, very little deliberation about the need for this and the value for this, and the people that were looking at each other across the table whether it was RiverMend or whether it was the University of Florida, and I'll give a shout out to Dr. Mark Gold if Mark is listening in. I don't know. Hey, hello, Mark. But we're adopting a model of treatment that Dr. Jacobs has brought with him from the University of Florida. And so there are a variety of partners who rapidly saw in each other the possibility of doing something important and new, and with a level of trust that allowed the whole thing to be accelerated on the path that you see today. What's also remarkable is that this particular model of cooperation between private parties with a university, with another university medical school partner assisting, I think is unique, if I'm correct. This is the first of what hopefully will be a replicated model. And the Bluff Plantation and its associated services are going to do something good for each partner. I think that also made it very easy to move forward quickly. And I would just add to what Dr. Buckley has already said about the opportunities for training for residents and hopefully in the near term fellows with also medical students. And just as we, I think as a profession have done a marginal job, or maybe some would say a poor job in teaching substance abuse principles of treatment to residents and fellows, is equally as bad, if not worse, for medical students. And it's virtually impossible to be a physician in any field where your practice is not complicated by the presence of alcoholism and substance abuse, often in ways that you don't suspect because of the secrecy associated with substance abuse and alcoholism, leading to failed treatment plans in internal medicine, surgery, pediatrics, and so forth. So I am hoping that apart from training our graduate medical education trainees, that we can make an impact on the medical students as well. And finally, although that the Bluffs will be a facility that will help persons from all walks of life and is not devoted obviously just to professional people, being a physician, I can't help but hope that my physician colleagues get a big bang out of this, because when we fail as physicians and suffer from substance abuse, the implications are horrific. And many people's lives are touched, not only the patients themselves that are being treated by an addicted physician, but also that physician's or other health professionals' partners. So the implications are huge, and you can treat just one person at the Bluff Plantation and have a benefit that ripples through dozens, maybe hundreds of people that you'll never know. I do think this would be a great thing for Augusta. We have many things, many reasons to be proud of the city of Augusta, and we're going to add this to the list. Thank you, Dick.
Thank you, Dr. McCall. Now I'd like to introduce a good friend and colleague, Dr. Dan Angris. Dan's come down to us today from Chicago, where he's the medical director of Positive Sobriety Institute and chief medical officer for the addiction arm of RiverMend Health. He's an associate professor of psychiatry at Rush University of Medicine, adjunct associate professor of psychiatry at Northwestern. As a Rush faculty, he taught medical students, interns, residents addiction medicine. He's lectured extensively on addiction. He's the author of 2 books, and he and I have the pleasure of co-authoring another one we're working on right now. He's also completed his first novel, Miss Wired. He's been involved in the field of addiction medicine since 1982. He's now director at our partial hospitalization and intensive outpatient program in Chicago. He's been involved for years with the professionals program both in Chicago and nationally. We have a lot of things in common. We're kindred souls in our philosophies of how we treat patients, and it's been my pleasure to work with him. Dan?
Thanks, Bill. An amazing experience to be here. I mean, just walking out for the first time, seeing this facility this morning and seeing this incredible vista. just sort of culminates my, experience that started with RiverMend about a year ago. When I was invited by Dr. Gold to be part of the scientific advisory board. Didn't know much about it, but knowing that it was run by Dr. Gold, of course, got me very excited. He's always been there for me and so many others to sort of further our careers and in a very selfless way often. And so we met in Pepperdine last September. It's been quite a year, but at this advisory board meeting, I said, my God, this is amazing, having an entity that actually aligns with academic centers. And having been in this field as long as I have, it seemed very attractive to me, the kind of thing that perhaps I'd like to do when I grow up. And so as the months went by, I thought more about it, talked with some people, especially at Northwestern, where I've been more active. And the next thing I know, I'm now 3 months into being part of this organization. Yesterday, I had an opportunity to meet with the leadership at Northwestern and talk about, the potential affiliations. It took a while to get to the very top of the organization, and the enthusiasm and warmth and interest was above and beyond what I expected, which also shows me how this field has evolved into what it is today and what the need is in terms of treating this disease and doing it in an expert way. So we talked about, well, how can we do this, and how can the affiliation work, and how can we have some inpatient synergies, et cetera. And I said, well, wait, don't go anywhere. I'm going to our center in Augusta, where my counterpart, Dr. Bill Jacobs, has set this up, and it's been amazing. This morning, meeting some of the key people at GRU and seeing what's happening here. I mean, it's remarkable. So it's also very exciting now to go back and to have a template that I think can not only be reproduced where I am, but I can see reproduced everywhere, because the concept is so important. As addiction has become really epidemic worldwide, we need to have people appropriately trained and have the synergies of cutting-edge academic medicine and psychiatry with us. So it's a very exciting process. And finally, I'll tell you this really with another hat on as a referral source. So this morning I happened to be able to meet with someone I sent here. I had some difficulty because I didn't recognize him. In 2 weeks, the transformation has been remarkable. And I think that just speaks legends about really what's happening at a center like this, and I'm very grateful for that especially. So hats off to Dr. Jacobs and what's happening here in GRU, and just a remarkable process that is inspiring to all of us. Thank you.
All right. Last but not least, Monica Demetor is the Chief Executive Officer for RiverMend Health. She previously served as Chief Operating Officer for American Access Care, leading provider of interventional radiology services. She's grew that to over 30 treatment centers, serving more than 30,000 patients annually. She's got tremendous leadership skills. Working with Monica over the last year and a half has been a real pleasure. She's a great leader. She's got unbelievable business acumen. She's got leadership skills, and she's got firsthand experience as a clinician in delivering health care. The first time I met with her, even though she didn't have a great extensive background in addiction medicine, she got it. She knew immediately that this disease is a chronic illness, and she knew that we had to treat it as such, not in the episodic revolving door method that we've been using for years in this country. So I'm really, really excited to have her working with us at RiverMend and leading this team. Thanks, Monica.
Good afternoon, everyone. It's really exciting to be here today. It's working on this project with the team since January of last year when I first started working as a consultant for Northwest Venture Partners to get this concept and idea off the ground. Dr. Gold and I had the opportunity to work very closely together over the past few months to make this a reality. And this is the first site that we're opening as a de novo in collaboration with our academic partners at Georgia Regents and Medical College of Georgia. And it really has been, like Vaughn was saying earlier, the process has gone remarkably quickly. When they first told me, when we started working together, and Dr. Gold and Northwest Venture Partners told us that we were going to be doing academic partnerships with private equity, I was like, really? I don't think we could get that done fast enough. Because I have worked in my previous life, done a lot of hospital and academic partnerships, and usually the process takes years to get done. So the fact that we're here today really speaks to the commitment, I think, from both parties, both RiverMend Health and from Medical College of Georgia, Georgia Regents. And I think specifically to the Department of Psychiatry, Joe Ricci, Dr. Jacobs, Juan McCall, Peter Buckley. There really was a commitment on the part of the university and the medical school to really get this done and to really create something special, not just here at the Bluff, but in Georgia for the residents suffering from addiction. So very, very excited to be here today. And really to be presenting opportunities for people with this disease process that is very different than what's out there today, really a new paradigm of treatment for our clients. Looking at it as a chronic illness and really looking at how we can treat and keep connected with our clients over the long term. This isn't something that is like Dr. Jacobs and others were saying earlier, this isn't something that can be treated with episodic care. It's very much a chronic disease like diabetes, heart disease. It really needs a long-term vision and long-term approach to care. We wouldn't be here today, though, without the really hard work of some key people to make this happen. It's great for us in our offices and getting contracts and all that done, but to actually operationalize something like this really takes a phenomenal amount of work and effort. And so I would just like to speak about the team that has really made that happen over the past number of weeks. Without, number one, Julie Eberwein, without her leadership and dedication and hard work down here with the team, it just wouldn't have happened. TJ Eberwein, Catherine Harris, Will Kennedy, Chris Barr, and Tina from the very beginning started here. She was she was the second person to join the company. I was the first one and Tina was number 2. She's been here from the very beginning, working with local people to sort of get this project. But most recently, getting it up and done, Julie really has made this come to be a reality. Since then, since we actually started accepting clients in our sort of pre-opening phase, Shelby Jacobs, Steve Henderson, Evan Reinhardt, Curtis Chambliss, Mary Bergeron, and Jimmy McCoy have all been contributing to the delivery of care of our clients here. So I just really want to give a really big hand and thank you to that team because we wouldn't be here today without them. So once again, thank you all. It really has, we're very excited about this opportunity and looking forward to working together with the Medical College of Georgia and Georgia Regents to really make this a state-of-the-art and a place that really is delivering care that's based in the science and evidence. So thank you so much.
That concludes the formal part of our presentation today. Please stick around, have some more food, have some more to drink, cool off, look around. If you haven't had a chance to see the cottages, please go in the cottages and see where our patients are staying. I don't think anybody can leave here without seeing what a healing place this is, what potential it has, and where we're going to go with this. Thank you all.
You gonna mingle?
No, I think I probably need to get on back. So is that how you feel? I'm going to talk. Is this the cook here in the white shirt? Yeah.
We have a camera. Master is here too.